Hello, I'm Kate Langford and I'm the Chief Medical Officer of NHS Kent and Medway. So what does a Chief Medical Officer of an ICB do? Well, I'm part of delivering the 4 key aims that every ICB has. So we are here to address healthcare inequalities and improve the health of the whole population. We're here to make sure that people get good access, outcomes and experience from care. We're also here to make sure that we are as productive as we can be and add to the wider economic development of an area and improve the social well-being of the whole area. And in all of those places, I have healthcare sciences playing their part in delivering that. So healthcare science leadership is incredibly important in delivering those programs because healthcare science professions as a whole are so broad and diverse, over 50 different areas, and so is the portfolio of an ICB, and there are many different places that healthcare leadership can play into delivering that. So if I just think of a few examples from my own area, we have, for example, programs delivering the clinical care of patients, and healthcare scientists are incredibly important in helping us prehab patients who are waiting for surgery so that they get really prompt access to their surgery and recover quicker. We have incredible clinical professional leadership in terms of developing our workforce that's being led by healthcare science colleagues, and particularly in that space doing some excellent work reaching out into higher education and indeed into sixth forms in schools in order to let local people know what healthcare careers are available. And when you think about the vast number of really exciting new careers there could be, many people in sixth form won't even have heard of these yet, let alone think, oh, that might be the right thing for me. So it's really important that our healthcare science leadership are out there and telling kids, you know, you might be the genomic scientist of the future, you might be going to go into healthcare AI. So that's an incredibly valuable piece of work. And of course I've mentioned AI and I've mentioned genomics, and those are both places where we're going to be at the cutting edge of care as we go forwards, and both of those will have a role to play as developing professions of the future. So I'm always really conscious that you think, well, what are the risks if I don't do this? And what would be the risks if I didn't take leadership from that very broad range of healthcare science input? Well, of course, I don't know what I don't know. The unknown unknowns are always a risk. So for me, it's hugely important to bring in all that wealth of knowledge and experience from the healthcare science professions to help inform how we're going to do healthcare better for people in future.